Dear viewers, now we shall discuss about blood-brain barrier, BBB, bioavailability, volume of distribution, prodrugs, coating of tablets, placebo, drug excipients, drug abuse, half-life, tmax, pharmacopoeia.
Blood-brain barrier, BBB. A boundary exists between the periphery and the central nervous system called blood-brain barrier. Criteria of blood-brain barrier. 1. It is a semi-permeable barrier. 2. Diminished rate of access of chemicals from plasma to brain. 3. Entry of drugs is restricted. Bioavailability. This is the percentage of administered dose of a drug reaching the systemic blood circulation. It is essential for therapeutic action. In pharmacology, bioavailability is used to describe the fraction of an administered dose of unchanged drug that reaches the systemic circulation, one of the principal pharmacokinetic properties of drugs. By definition, when a medication is administered intravenously, its bioavailability is 100%. However, when a medication is administered via other routes, such as orally, its bioavailability decreases due to incomplete absorption and first-pass metabolism, or may vary from patient to patient, due to inter-individual variation. Volume of distribution. It is the ratio between the total quantity of drug into the body and concentration of drug in plasma. Volume of distribution equals total quantity of drug in body by concentration of drug in plasma equals liter. Prodrug. A prodrug is a pharmaceutical substance that is administered in an inactive form. Once administered, the prodrug is metabolized in the body into an active metabolite, active drug, like diazepam is the prodrug of oxapam, cefuroxim Axtil in the prodrug of cefuroxim. Advantages of use of prodrug. 1. Improve absorption from the site of administration. 2. Avoid first-pass metabolism. 3. Improve bioavailability of drug. 4. Reduce local adverse effects of drug. Coating of tablets. Film-coated. Coating by an organic substance, like hydroxyethyl cellulose, to improve visual appearance, as well as enhancing the taste and masking objectionable odors. Sugar-coated. Coating of tablets by sugar solution to increase visual attractiveness and to mask the bitter taste and smell, like coating of vitamin tablet.
Enteric coated. Coating by a material to prevent or minimize the dissolution of the tablet in the stomach but allow dissolution in the small intestine. This type of formulation either protects the stomach from a potentially irritating drug, like aspirin, or protects the drug, like omeprazole, from partial degradation in the acidic environment of the stomach. Normally this type of tablet doesn't disintegrate in stomach but in intestine.
Placebo. A placebo has been defined as a substance that is objectively without specific activity for the condition being treated. Inactive substance given to satisfy patient demand for medicine is called placebo. A placebo, in this context, better termed dummy medication, is an indispensable element of many controlled clinical trials.
Placebo is used mainly for the following purposes. As a control in scientific evaluation of drugs. To benefit or satisfy a patient not by any pharmacological actions, but by psychological means.
Drug excipients. Excipients are pharmaceutical additives, the inactive ingredients used to make up a medication. They include dyes, flavors, binders, emollients, fillers, lubricants, preservatives, and many more classifications. Like diluents, that is lactose, starch, etc. Binders, that is acacia gelatin. Disintegrates, that is sodium starch glycolate, methyl cellulose, etc. Lubricants, that is magnesium stearate, stearic acid.
A pharmaceutical additive must be safe in the amount used in the drug, not affect the bioavailability and performance of the drug, be manufactured in accordance with good standards.
Half-life. It is the time taken for the concentration of drug in the blood or its original value, ppc. It means the time required to reduce 50% of drug from ppc. T-half is always constant for each individual drug and individual dose. Importance of half-life. A half-life determines the dosing interval of a drug. Longer half-life indicates larger dosing interval and longer duration of action. B. Longer half-life usually indicates more protein binding.
Tmax. The time requires to reach the ppc level, from AUC, Tmax is 30 minutes. Importance of Tmax. Calculation of dose. Judgment of dosage form. Determination of dose interval. Determination of duration of action of drugs.
Onset of action. This is the time required to achieve the drug concentration in MEC level. From AUC, onset of action is 4 minutes.
Pharmacopoeia. Pharmacopoeia is an authorized treatise on drugs and their preparation, especially a book containing formulas and information that provides a standard for preparation and dispensation of drugs. The well-known pharmacopoeias are British Pharmacopoeia, BP, British Pharmaceutical Codex, BPC, British National Formulary, BNF, United States Pharmacopoeia, USP.
Counter, OTC, drug. Those drugs which can be used supplied without prescription, medical supervision, are called OTC drug. The OTC ingredient should be safe and effective for consumer use without medical supervision. Like paracetamol.
Teratogenesis. Teratos monster, genesis equals production. The production of deformity in the developing embryo is called teratogenesis.
Teratogenicity. It refers to the capacity of a drug to cause fetal abnormalities when administered to the pregnant mother.
Carcinogenesis. Malignant and benign tumors occur spontaneously and can also be induced by drugs or other chemicals, sometimes as a result of mutation. The possibility of malignant tumors being caused by drugs is called carcinogenesis.
Chemotherapy. The term chemotherapy is used for the drug treatment of parasitic infections in which the parasites, viruses, bacteria, protozoa, fungi, and worms are destroyed or removed without injuring the host. The use of the term to cover all drug or synthetic drug therapy needlessly removes a distinction that is convenient.
Drug abuse. Drug abuse refers to use of a drug by self-medication in a manner and amount that deviates from the approved medical and social patterns in a given culture at a given time.
Potency. In the field of pharmacology, potency is a measure of drug activity expressed in terms of the amount required to produce an effect of given intensity. It is the amount, weight, of drug in relation to its effect. A highly potent drug, like morphine, alprazolam, produces a larger response at low concentrations, while a drug of lower potency, ibuprofen, acetylsalicylic acid, produces a small response at low concentrations. It is proportional to affinity and efficacy.